Hi, I'm Amy O'Donnell, the Communications Director at Texas Alliance for Life, and I'm here at the Capitol with Dr. Ingrid Scott for a very exciting TAL update. Dr. Scott, you're here with us today, taking time away from your busy schedule. Can you tell those watching what you're doing with our team at the Capitol today?
It's great to be here to educate the politicians about Texas law. I'm an OBGYN practicing in Texas for over 30 years. In addition, I've researched these issues with my work with Charlotte Lozier Institute. I understand the law. I understand how doctors are supposed to practice. And I recognize that really nothing has changed in my practice. About 90% of OBGYNs do not do elective abortions, and that continues to be the case, that we do provide interventions when needed in the setting of a maternal emergency. The law allows us to continue to use our reasonable medical judgment. And so I'm here to really encourage my fellow obstetricians that nothing has changed in their practice, that the law gives broad deference to their judgment. And sadly, I think there has been a lot of media misinformation with the intent of confusing doctors and causing fear. Happily, no doctor has been prosecuted for performing an abortion to protect a mother's life. The law allows that action if the doctor feels it's needed. And I just want to continue to keep women in Texas safe by encouraging their obstetricians that they can continue to practice the way they always have.
And we're so grateful to have her voice in the mix of these conversations because she has firsthand experience delivering babies and taking care of women in the state of Texas. The Human Life Protection Act was one of the top priorities for Texas Alliance for Life. And when it passed, we never could have imagined that Roe would be overturned soon after that. The law then took effect after Dobbs overturned Roe. And so since then, we've seen all of this misinformation in the media. And yet we continue to say that the law is clear, the language is clear. The Supreme Court has reiterated the clarity of the language in our laws in two cases, Cox and Zaraski. The Texas Medical Board has issued rules saying that there is nothing in the law that says a threat to the mother's life or health has to be imminent. So it's not our goal to change the language in the law this session. We're working on continued medical education. Dr. Scott, can you share a little bit more about what that looks like for physicians and with regards to the Human Life Protection Act?
Yeah, absolutely. Whenever a new law has impacted the practice of medicine, our professional organizations in the past would explain the law to us. We're not attorneys in most cases. We really just need the encouragement of what the law says and how we should continue to practice. That hasn't happened, perhaps for ideologic reasons, but I believe that it is getting ready to happen. I believe that there is strong motivation on the part of many people to provide continuing medical education to physicians, to help them understand the law, to help them recognize that if they continue to give quality medical care, that no one will come for their license, that there is no reason to fear, that Texas wants the women in the state to be cared for with quality care. And if doctors are doing that, they have no reason to worry.
The reality is Texas takes care of women and babies. The language in our law is clear. We are all in favor of continued medical education for physicians, and we're grateful again to have Dr. Scott with us in these conversations. Thank you for tuning in to this week's TAL Update.